Metro rail ridership is down 90% of what it usually is. Metro bus is down about 60%. Coronavirus has significantly impacted public transit ridership. It truly is unprecedented. We're talking just really, really big impact as people stay home, as people work from home, as people, limit travel. It's really nothing quite like it that we've ever seen. My name is Jordan Pascale, and I cover transportation for WAMU Public Radio. It's Washington's local NPR station, and I've been covering transportation here for about 2 years, but I've been covering transportation throughout my career in Nebraska, where I'm from, and also in Virginia as well. So many people thinking about the future. Obviously, we've known some sort of pandemic was going to come at some point, and it likely will come again at some point. So, Metro was lucky enough that they had already planned for this. They had a playbook in January, February. They were already buying cleaning supplies and stocking up on gloves and masks and all that sort of stuff for employees. Montgomery County specifically has been responding very well to the pandemic. Early on, they were pioneers of getting masks, individual masks from the county that they purchased, and they put them in baggies and made them available on buses. So that's, mask wearing is one of the key things to stop the spread of coronavirus. Whether it's safe or not to ride on public transit is one of the toughest questions I think a lot of people are thinking about as individuals right now. I know a lot of workers are still able to work from home. There's a lot of people that don't have that luxury. You've got your essential workers that are the grocery workers, the hardware store workers, people that have to go physically to their jobs. Those people are already making those decisions every day, and it's the decision between, do I feel safe on public transit or do I earn a paycheck? As to whether it's safe, we don't know yet. We've got bits and pieces of data. The CDC came out recently and said that, transmission through surfaces isn't as prevalent as they once thought. So, it lives on a surface for a little bit, but they say the chances of passing it, from touching it to touching your face is rare, and that you probably don't get it that way. It's mainly transmission through these air droplets. I hadn't taken Metro since March 13th or March 15th or something like that, and recently was on a bike ride and my tire went flat, and so I had to take the train, and it was very full. It was, probably 7 or 7:30 on a weeknight, and it was the sort of thing where you got on and there were pretty much people, not every seat, but there certainly wasn't 6 feet of distance. The mask policy is something that is technically mandatory, but is not enforced. They don't want to get into altercations with people over whether or not to wear a mask. They're really relying on a lot of social pressure, a lot of kind of peer pressure to enforce that policy. I think a lot of people, especially people in public transit agencies, are looking forward to a normal. I don't think there is a going back to what we had. There's a lot of industries that will never go back to what we had before. Even after the pandemic's over, we'll be conditioned for many, many months to keep 6 feet away from people. So what does that look like? It's going to be a really big challenge for public transit, because the whole idea of public transit is moving a lot of people quickly at the same time in small spaces. So, when will that ridership come back? How will the funding respond? Will transit have enough to keep going? There's so many questions that are going to need to be answered. And, I guess it'll take probably 6 months, a year plus to know all the answers.